One. Just weeks ago, Nigeria was a mere spectator to the deadly Ebola crisis sweeping West Africa, but now there are fears that that country could be on the verge of becoming the next hot zone for the virus, with health officials there warning every nation and every individual is at risk. Dr. Tom Frieden, the director of the Centers for Disease Control and Prevention, testified before a congressional committee today about the serious nature of the outbreak, warning that it requires, quote, meticulous attention to detail, unquote, because if just one patient, one, is not isolated, it will flare back up like a forest fire.
We can stop Ebola. We know how to do it. It will be a long and hard fight, and the situation in Lagos, Nigeria, is particularly concerning. But we can stop Ebola. Second, we have to stop it at the source in Africa. That's the only way to get control.
Let's bring in CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, good to see you. So Dr. Frieden warned of the severity of the outbreak, but he clearly believes there's a plan in place to get it under control. What is this plan?
Well, you know, he sort of predicates this a little bit on the fact that they've always been able to get Ebola outbreaks under control. Now, admittedly, this is the biggest, most widespread Ebola outbreak in history. But it really has to do with dealing with things on the ground in West Africa, breaking up some cultural practices that seem to be adding to the spread of the disease, particularly around funerals. This is a big deal. We saw some of this when we were in Guinea as well, but the idea of public funerals where there's a laying on of the hands at a time when the body is really still shedding a lot of virus is a huge problem. And until you start to stem it at the source there, you're really not going to get control. You can do things with screenings of airports and border shutdowns and things like that, but that's not really going to control the problem. He also made another interesting point, Jake, was that the public health infrastructure is bad there. We've known that for a long time, but it's so bad that things like this just sort of go unchecked. And unless that public health structure is invested in and built up, even after this Ebola outbreak is controlled, this will happen again. So it really has to be a combination of both those things, building up that public health infrastructure as well, and it's going to require money.
We also heard testimony today from the VP of Samaritan's Purse at the hearing. He says the international response has been a failure and the full impact of Ebola has not yet been realized. How so?
Well, the failure part, I think a lot of it comes from just being late, especially on behalf of some of the governments in the area. You're hearing these states of emergency being declared now, doing things like preventing, actually requiring cremation of bodies as opposed to these burials that I was talking about where the epidemic has been spreading. But it all came kind of late. And so I think that's been a huge part of his concern. And also the fact that the numbers, as we know them, we're talking about some 1,700 infections. When you go to these remote areas, there are so many people who never get counted. They have no interest in interfacing with the medical establishment. So he thinks we're getting maybe 25 to 50% of the actual numbers. So just multiply by 2 to 4 all the numbers that you're hearing in terms of infections and fatalities. And that's what he's referring to as well. We don't have a handle on this, even in terms of the most basic data collection and counting people. It's hard to do, admittedly, but you need a lot of people on the ground to make it happen, and that's just now starting to happen 4 months into this thing.
And Sanjay, lastly, the Senate committee brought up this experimental serum several times during the hearing. It's a story you broke on Monday. We're short on time here, but what did the CDC have to say about this serum? Are there any plans to fast-track approval?
I think there's a lot of fascination by all these agencies, but I'll tell you, there's also a lot of sort of saying, look, the CDC saying, we think it's interesting, but that's not our area. This is more the NIH and the FDA's area. When we talk to the NIH, they say you need to have clinical trials. We understand that it may have shown some promise in these 2 patients who were the first 2 humans in the world to ever get it. But, we can't start recommending it for large segments of the population until we get a little bit more data. Is it safe? I mean, look, some say, what's the harm if somebody's going to die anyways? Well, there could still be problems. You have 40% of people who survive, and this could cause potentially problematic side effects they want to avoid.